Hey everyone, welcome back to the Deep Dive. Today we're taking on a fascinating subject. It's one that has drawn millions of followers worldwide, really stretching from ancient spiritual traditions right up to modern celebrity endorsements. We're talking about Transcendental Meditation, or TM. Now, you've probably heard a lot about its benefits, maybe seen a famous face attribute their success to it, or perhaps just wondered if it could be something for you. But beyond the hype, what is TM, really? What does the science genuinely say? And maybe more importantly, what are some of the less talked about aspects you should probably be aware of?
It's truly a complex landscape. You've got evidence, personal experience, and sometimes it seems quite contradictory, doesn't it? Our goal in this deep dive is to sift through the sources you shared with us, pull out the most crucial nuggets of knowledge, and hopefully equip you with a really comprehensive understanding of TM. That means looking at both its celebrated benefits and its significant controversies. So where should we start to unpack this? Okay, let's unpack this. We should probably kick things off with TM's origins, right? And what the practice actually involves day to day, even down to its surprisingly unique learning process. Then we'll dive into the impressive physiological and psychological benefits, things like blood pressure, stress hormones, PTSD, even creativity. But we won't stop there. We're going to critically examine the scientific claims, address those accusations of it being a cult, which you hear quite a bit, and grapple with the whole question of its religious nature. Is it secular, is it not? And finally, we'll compare TM to other popular meditation styles and offer some, let's say, nuanced recommendations for anyone out there considering this path,
Yeah.
understanding transcendental meditation from roots to ritual. So let's start at the beginning. For listeners maybe familiar with general meditation, what exactly is transcendental meditation? Where did it come from?
Well, Transcendental Meditation is a specific, standardized, and it's actually trademarked for form of silent mantra meditation. It was developed back in the 1950s by Maharishi Mahesh Yogi. But its origins, they're deeply rooted in the ancient Vedic tradition of India. And that tradition really emphasizes direct experience over, say, dogma or belief. That's pretty key to its philosophy.
That deep lineage is fascinating. How did a practice with such ancient roots then, blow up into the global phenomenon we see today?
Right. Well, Maharishi Mahesh Yogi started teaching around 1955. Initially, he called it Transcendental Deep Meditation. He began world tours in 1958, but the really pivotal shift happened in the 60s and 70s. He very strategically reframed TM, moved it away from being seen as purely spiritual and presented it more as a secular scientific technique. That, combined with some very high-profile endorsements, think the Beatles, the Beach Boys, really catapulted TM into the Western mainstream. It just grew into this global movement. Maharishi set up formal training programs, structured the whole thing almost like a multinational corporation. This era also saw the development of the science of creative intelligence, or SEI. That's kind of the philosophical framework behind it, rooted in Vedanta.
Okay, so for someone actually sitting down to do it, what does the practice involve? What are they doing when they practice TM?
At its core, TM is actually a simple, silent mental technique. You practice it for about 15 to 20 minutes twice a day, usually morning and evening, just sitting comfortably with your eyes closed. The key thing is the effortless, silent repetition of a mantra. Now, this isn't just any word. It's a sound chosen supposedly for its vibrational quality, and it doesn't have a specific meaning attached to it. The term mantra itself comes from Sanskrit. It means mind vehicle, basically designed to guide the mind to quieter, subtler levels of awareness.
So it sounds like it's definitely not about trying to force your mind to go blank or clear your thoughts, which, let's be honest, can feel impossible sometimes.
Exactly. That's a really important distinction. The goal isn't concentration or trying to empty the mind. Those are seen as effortful. Instead, TM is designed to be completely effortless. It taps into the mind's natural tendency to seek happiness, to seek quiet. So, by just innocently favoring the mantra, the mind is said to spontaneously settle down. It experiences what proponents call the source of thought. This state is called pure awareness or transcendental consciousness. They describe it as restful alertness. It's considered a fourth major state of consciousness, actually distinct from waking, dreaming, and deep sleep, a whole different state.
Okay, now the way TM is taught is quite specific, right? You can't just pick up a book or download an app to learn it like you can with some other techniques.
That's absolutely a defining characteristic. The TM organization insists very strongly that the authentic technique can only be learned from a certified teacher, and it has to be through their formal multi-day course. This basically makes it a proprietary system, which yes, ensures consistency, but also, as you might guess, it creates a pretty significant financial barrier for a lot of people.
Right, that financial aspect certainly raises eyebrows. And
Hmm.
I've heard that beyond just the cost, the learning process itself involves something quite specific, almost like a ceremony. That's drawn some criticism. Can you shed some light on that?
Yes, that's correct. The learning process typically starts with a free introductory lecture. That's open to anyone. But then if you decide to proceed, there's the paid course, usually spanning 4 consecutive days. On the first day, during a one-on-one instruction session, you receive your personal mantra. And this session includes what they call a ceremony of gratitude, or puja. What happens is the teacher performs a brief ceremony, reciting in Sanskrit, in front of an altar. The altar usually has a picture of Guru Dev, who was Maharishi's master. Students are asked to bring specific offerings, things like fresh fruit, flowers, and a new white cloth. Now, the TM organization presents this as just a non-religious gesture of thanks, a way to honor the tradition. But critics, and actually even some legal rulings, have identified it pretty clearly as a Hindu religious ritual. According to Hindu tradition, bringing those offerings, the dakshina, technically makes the student an active participant in the ritual. And that's a detail that's not always, let's say, fully disclosed up front to people who think they're just learning a purely secular scientific technique. This duality is a frequent point of contention.
Okay, so on that note of cost, you mentioned a significant financial barrier. How significant are we talking, especially compared to, say, free meditation apps or resources?
It is significant, absolutely. The cost for the standardized course is substantial. It's often on a sliding scale based on income. But in the U.S., fees can range anywhere from several $100s up to nearly $1,000. And there have been times when it was even higher, reportedly as high as $2,500.
Wow.
Yeah. Now, they are a nonprofit organization, and they do offer scholarships or payment plans. And there are charitable arms, like the David Lynch Foundation, that provide it free to certain at-risk groups, like veterans or inner-city kids. But still, the high standard cost is a consistent criticism. It just makes it inaccessible for many people.
Mm.
It is worth noting, though, that once you complete the course, you supposedly receive lifetime follow-up support. That includes free meditation check-ins with teachers and access to group meditations anywhere in the world. 2. The science of calm. Physiological benefits of TM.
That sounds like a powerful state of rest they describe. And I know the TM organization really champions the scientific validation behind its claims. So, what are the most robust physiological benefits? What have researchers actually pinned down?
Okay, yeah, the science part. The most extensively researched benefit, and probably the one that's gained the most mainstream recognition, is its effect on cardiovascular health, specifically blood pressure. The key takeaway here isn't just some marginal improvement. It's that multiple robust studies, including a major meta-analysis back in 2008 that looked at 9 randomized controlled trials. These studies have consistently shown that TM can lead to significant drops in blood pressure. We're talking about, on average, around 4.7 points systolic and 3.2 points diastolic reduction compared to control groups.
That's pretty specific. That sounds like something the medical community would pay attention to. How did the American Heart Association react to that evidence?
They did pay attention. In a 2013 scientific statement, the American Heart Association, the AHA, concluded that TM is, quote, the only meditation practice with sufficient evidence to be considered as a potential adjunctive treatment for hypertension. Non-pharmacological, of course.
An adjunctive treatment, so alongside other things.
Exactly. They were careful to note that other lifestyle interventions like diet and exercise were generally more effective overall. But they recommended that clinicians could consider TM for individuals whose blood pressure is above that 190/80 millimere Hg mark. And that endorsement was a really major step. It helped bridge the gap between what was seen as an alternative practice and mainstream medical acceptance, largely because, blood pressure is a hard, quantifiable biomarker.
Okay, so blood pressure is a big one. Are there other heart-related benefits beyond just the numbers on the cuff?
Yes, definitely. The research suggests TM might actually impact the underlying pathology, the root causes of cardiovascular disease. For instance, there are at least 2 randomized controlled trials showing it can reduce carotid artery intermediate thickness. That's a key measure of atherosclerosis, the hardening of the arteries.
Right.
One of those studies, done with hypertensive African Americans, projected that the reduction they saw could translate to about an 11% lower likelihood of heart attack or stroke after just 8 months of practice. There's also evidence of lower cardiovascular mortality rates in elderly TM practitioners over a 15-year period, improved exercise tolerance, reduced enlargement of the heart's main pumping chamber. And some studies analyzing health insurance claims databases found that TM practitioners seem to have substantially fewer hospital admissions, both inpatient and outpatient, specifically for cardiovascular disease. In one case, it was something like 87% fewer admissions and lower overall medical costs over time.
Wow, 87% is huge. So it's about the heart, but it's also fundamentally about stress, right? That seems to be the connection. How does TM impact our body's basic stress response system?
This is absolutely crucial. Stress reduction is really the proposed mechanism behind many of these benefits. TM is claimed to significantly reduce cortisol, which is the body's main stress hormone. Research indicates that cortisol levels can drop by 30% or even more during a 20-minute TM session, which is interesting because that's actually a greater reduction than you typically see even during a full night's sleep.
Really? More than sleep?
Apparently so, in terms of acute cortisol drop during the practice. And then regular practice seems to lead to lower baseline cortisol levels over time. This hormonal shift is linked to a broader normalization, a kind of balancing of the body's regulatory systems. TM seems to decrease activity in the amygdala, that's the brain's fear center, its alarm bell. And it helps downregulate the HPA axis, the hypothalamic pituitary adrenal axis, which is the core of our stress response. So this shifts the autonomic nervous system away from fight or flight and towards the parasympathetic rest and digest system, promotes deep recovery. We also see things like increases in serotonin, which helps regulate mood, and lower levels of adrenaline.
Are there observable changes in the brain itself that scientists have managed to pinpoint using things like brain scans?
Absolutely. EEG studies those. The brain's electrical activity show a really distinct pattern during TM. What you see is a significant increase in the coherence of alpha-1 brain waves, especially across the frontal lobes, the front part of the brain. Think of coherence like your brain's electrical activity becoming highly synchronized, like an orchestra playing perfectly in tune instead of just noise. Alpha waves themselves are associated with relaxed wakefulness. But the high degree of synchrony, this coherence seen during TM, is considered pretty unique. It's interpreted as the neurophysiological signature of that restful alertness state we talked about. And the theory is, with regular practice, this heightened coherence doesn't just happen during meditation. It can become a stable trait, leading to more integrated, more efficient, maybe more resilient brain functioning, even when you're not meditating. More recent research is also looking at TM's effect on the brain's default mode network, the DMN. That's the network that's active when your mind is wandering, kind of daydreaming. The idea here is that TM provides a kind of lower noise, deeper form of rest for the DMN. This leads to a quieter mind overall, a more stable sense of self, and perhaps allows for those creative aha moments to emerge more easily.
It sounds like a real domino effect of positive changes. Does this extend to other areas, maybe things like sleep or immunity or even aging? I think I saw something about that.
Yes, the claim is that these systemic effects, the stress reduction, the neuroendocrine balance, they do impact those areas.
Yeah.
By lowering cortisol and potentially increasing serotonin, TM is reported to significantly improve sleep quality. It's sometimes used as an intervention for insomnia. Practitioners often report feeling more refreshed when they wake up, experiencing deeper, more restful sleep. And since we know chronic stress suppresses the immune system, the thinking is that by resetting the stress response, TM might help bolster immune function, make the body more resilient. And then, yeah, perhaps one of the most intriguing claims is about slowing biological aging. There was one older study that found long-term TM practitioners had a biological age based on certain physiological markers that was on average 12 years younger than their actual chronological age.
12 years. That's pretty dramatic.
It is. More recent research is looking at potential mechanisms. Things like finding lower expression of genes linked to inflammation and aging in TM practitioners. Or better preservation of cognitive processing speed as people get older, maybe greater resilience to chronic stress, contributing to healthier aging. 3. Mind matters. Psychological and cognitive benefits of TM.
Okay, so beyond the physical, TM is obviously widely known for its psychological effects. What's the evidence for its impact on things like anxiety, depression, maybe even trauma?
Right, the mind side of things. The core psychological benefit always attributed to TM is the reduction of stress and anxiety. Particularly trait anxiety, this your sort of baseline level of worry, your general tendency towards anxiety. There was a big meta-analysis back in 1989, looked at 146 different studies. It concluded that TM was actually more than twice as effective in reducing trait anxiety compared to other meditation and relaxation techniques studied at the time.
Twice as effective.
That was the finding of that specific meta-analysis, yeah. A more recent one, from 2013, looked at 16 randomized controlled trials. It reinforced this, finding TM significantly more effective than just treatment as usual for reducing trait anxiety. And it noted the largest effects seem to be in populations with high levels of anxiety to begin with, people like veterans with PTSD or prison inmates.
And what about depression specifically? Does it help there too?
Numerous studies have shown that TM practice leads to significant reductions in symptoms of depression. These effects have been seen across various groups: college students, physicians dealing with burnout, people with post-traumatic stress. The mechanism is believed to be linked back to those physiological effects we talked about: lowering cortisol, maybe increasing serotonin, helping regulate the nervous system.
Now, speaking of post-traumatic stress, its application to PTSD really stands out in the research. It's often described as a non-trauma-focused intervention. What does that actually mean, and why is it important?
That's a really crucial distinction, and potentially a key advantage over some conventional therapies for PTSD. Non-trauma focused means that TM does not require patients to revisit, recount, or re-experience their traumatic memories. This effortless, non-confrontational nature can be particularly helpful for individuals whose nervous systems are already hypervigilant. Trying to concentrate or directly process emotions can be incredibly difficult for them. TM kind of bypasses that direct engagement.
So it works differently than, say, exposure therapy.
Exactly. It approaches it from a different angle, aiming to produce deep physiological rest and allow the nervous system to naturally heal and re-regulate, rather than confronting the trauma head-on. And the evidence for TM's efficacy in PTSD is actually quite substantial now. There was a groundbreaking meta-analysis published just this year, 2024, in the journal Medicina. It analyzed 61 studies on various meditation types for PTSD. What it found was that while pretty much all meditation types were helpful to some degree, TM demonstrated a large effect size. And importantly, that effect size was significantly greater than the moderate effect sizes found for mindfulness-based stress reduction, MBSR, and other mindfulness techniques included in the analysis. It also concluded TM was non-inferior to prolonged exposure therapy, which is considered a gold standard treatment for PTSD, and appeared to work more rapidly. Meaningful reductions in symptoms were often seen within just a month of starting practice.
That is a powerful finding, especially given how challenging PTSD can be to treat. Now, with such strong positive results reported, are there any caveats we should mention? For instance, how well do these studies control for things like the placebo effect? Or are there specific populations where TM might be less effective for PTSD?
That's a very fair question, and it's always important to look critically. While that 2024 meta-analysis is quite robust, many meditation studies, including those on TM, do face challenges in perfectly controlling for placebo effects. I mean, think about it. You're getting personalized instruction, often paying a fee, you have high expectations. That can create a strong placebo response.
Sure.
However, the consistent finding of a large effect size, specifically for TM, across multiple studies in PTSD populations, does suggest there might be something more than just placebo going on, probably related to that deep physiological rest it induces. As for specific populations, the research tends to highlight its effectiveness most clearly in those with high baseline anxiety. Whether it's equally effective for all subtypes of PTSD or for people with lots of co-occurring conditions, that probably needs more targeted research.
Okay, that makes sense. Now, beyond addressing distress like anxiety or PTSD, what about enhancing cognitive function or fostering personal growth? Does TM help with things like focus or creativity?
Yes, TM is definitely promoted as a tool for enhancing normal cognitive function and also for fostering self-actualization, realizing your full potential. Proponents, like the filmmaker David Lynch, who's a big advocate, really tout its ability to enhance creativity. And this claim actually has some support from studies using objective measures, like the Torrance tests of creative thinking. These studies have found TM practitioners scoring significantly higher on things like figural originality and verbal fluency.
Interesting.
These cognitive gains are often theoretically linked back to that increased EEG coherence, that more integrated brain functioning we talked about earlier. The idea is a more orderly brain is a more creative and efficient brain. Research also suggests TM can improve focus and enhance something called field independence. That's a cognitive ability linked to seeing the bigger picture, having greater mental clarity, not getting lost in the details.
But I saw something interesting about a potential creativity paradox with TM. What's that about? It sounds a bit counterintuitive as it's supposed to boost creativity.
Ah, yes, the paradox. This raises a really fascinating point, and it is a bit paradoxical. Some anecdotal reports from practitioners themselves suggest that while TM might foster a more serene, perhaps more accessible form of creativity, it might simultaneously diminish the kind of anxious, ego-driven drive to create that fuels some artists.
Less angst, less art.
Kind of. One practitioner described how their inner monologue, their constant daydreaming, which they considered sources of creative ideas, really quieted down after starting TM. And this led to a reduced compulsion to work on artistic projects. Those projects suddenly seemed more like, in their words, unnecessary seeking for validation. So it suggests maybe a profound shift in your relationship with the creative impulse, moving it away from needing external validation or quieting psychological noise towards something more intrinsic, maybe more peaceful. It's a subtle but potentially significant shift. And beyond creativity, TM is said to promote self-actualization. That's a term from humanistic psychology, basically realizing your full potential as a person. A meta-analysis looked at 42 studies on this and found the TM program was about 3 times more effective in increasing scores on self-actualization measures compared to other medication and relaxation techniques. Individuals practicing TM also tend to develop more strongly defined, more positive self-concept. There's often a smaller gap reported between their perceived actual self and their ideal self.
So if we bring all these physiological and psychological changes together, what does this actually mean for everyday life, for how people feel day to day, how they interact with others?
Well, the cumulative effect reported is often a significant improvement in overall emotional well-being. Practitioners frequently describe a greater sense of inner peace, calmness, clarity, feeling less in their head, not constantly analyzing everything.
Yeah, less mental chatter.
Exactly. Less like a prisoner of the mind, as one person put it. Freed from constantly judging external events. This quieting of the internal chatter allows for more presence, a more direct experience of life, maybe less filtered by past anxieties or future worries. And the TM organization claims this internal shift naturally translates outward into better interpersonal relationships. People acting with more tolerance, more thoughtfulness, more compassion. And there are studies that seem to support this across different groups, from students to military personnel reports of improved relationships and social functioning. Gee, the other side of the coin. Critical examination and controversy.
Okay, despite all these really compelling benefits we've discussed, TM has definitely faced significant criticism and controversy over the years. Let's dig into some of those issues now surrounding its science, its organization, potential downsides.
Indeed. It's important to look at the whole picture. The scientific foundation of TM, while it's certainly voluminous hundreds of studies, it has been subject to some pretty rigorous criticism. The main issues usually center on bias and methodological rigor. This has led some critics to talk about a kind of walled garden of evidence, meaning there's this large body of research, mostly positive, generated from within the TM community or affiliated researchers.
Right, research done by people connected to the organization itself.
Exactly. A central and recurring criticism is that a large proportion of the published research on TM has been conducted by scientists affiliated with Maharishi International University, MIU, which used to be Maharishi University of Management or other TM-related entities. Critics argue this creates a powerful potential for what's called allegiance bias. Researchers might be, consciously or unconsciously, motivated to produce positive findings that support the technique they're associated with. Some even suggest the TM organization kind of gatekeeps research on its technique, making it harder for truly independent, unaffiliated researchers to get funding or access to study it rigorously.
So there's a real concern about who is doing the research. Does that mean there are conflicting findings coming from outside that walled garden?
Interestingly, yes. While the TM organization heavily promotes its own meta-analyses showing TM is superior, the broader scientific literature often presents a more complicated, sometimes contradictory picture. For example, there was a big meta-analysis published in JAMA Internal Medicine back in 2014. It reviewed 47 trials of various meditation programs. It found only moderate evidence that mindfulness meditation improved anxiety and depression. And crucially, it found low evidence that mantra meditation, which includes TM, had any significant effect on psychological stress outcomes.
Low evidence. That's quite different from what the TM-affiliated studies suggest.
It is. Another review in 2012 concluded that TM performed no better overall than other meditation techniques when studies were pooled. Critics also frequently point to potential publication bias, the idea that studies showing negative or no results might just not get published, or at least not widely publicized by the organization. And many individual studies have been criticized for methodological weaknesses. Things like using inadequate control groups. It's hard to control for the placebo effect when one group gets personalized instruction, pays a lot of money, and has high hopes, while the control group maybe just sits quietly or gets put on a wait list.
Right. The comparison isn't always fair.
It's exactly. However, it's important to note the TM organization and its affiliated researchers actively rebut these critiques. They argue that the sheer volume of positive evidence they often cite, over 600 studies from 200 independent institutions, simply cannot be dismissed as bias alone. They point to their own meta-analyses as strong proof of TM's superior efficacy, especially for anxiety reduction. And they do publish detailed rebuttals to specific critiques, even for their most controversial research, like the studies on the Maharishi effect.
The Maharishi effect, that's the claim about group meditation reducing crime, right?
Yes, the claim that large groups meditating together can create coherence in the collective consciousness and measurably reduce things like crime rates, warfare, terrorism. Highly controversial research, as you can imagine, and heavily criticized methodologically, but they defend it.
Okay. Beyond the science debates, the financial structure and those persistent accusations of it being a cult are also major criticisms. How do those claims usually manifest?
Yes, this has dogged the movement since the 1970s, really. The TM movement has been labeled a cult by various anti-cult groups, some former members, even some government inquiries in the past. The critiques often point to what they see as classic characteristics of high-demand groups or cults, things like a charismatic, almost deified founder figure in Maharishi Mahesh Yogi, a secretive, esoteric body of knowledge that you only get access to through the organization, a pretty rigid hierarchical structure, high financial costs, especially for more advanced programs or teacher training, and sometimes a tendency for the most dedicated followers to become quite insulated within the TM community, maybe discouraged from outside influences or critical thinking about the group.
And the money aspect.
Right. The organization's considerable wealth estimates have put its global net worth potentially around $3.5 billion, combined with those high fees charged for basic instruction. That's led to accusations that it operates more like a business than a purely spiritual or educational nonprofit, especially when course fees had been as high as $2,500. The heavy reliance on celebrity endorsements and very polished marketing materials is also seen by critics as further evidence of a commercial enterprise. Some have bluntly called the program a racket or a highly commercialized meditation product.
Those are serious claims. How does the TM organization respond, particularly to that cult label?
They vigorously deny the cult label, as you'd expect. Proponents argue strongly that the practice itself doesn't require adopting any specific belief system. They emphasize it's open to people of all faiths, or no-faith atheists. Agnostics practice TM. They also point out that the vast majority of practitioners probably have a pretty loose affiliation. They just learn the technique, practice it twice a day on their own, and don't get deeply involved in the organization's other activities or communities. As for the fees, they defend them as necessary. Necessary to support a global infrastructure, maintain high standards for teacher training, and also to fund their charitable initiatives, like the David Lynch Foundation's work. They consistently point out that they are registered as a nonprofit organization.
Okay, but this does raise that tricky question again about the religious aspect. How does the organization reconcile its generally secular, scientific, public presentation with those clearly religious roots and rituals, like the puja ceremony?
This is a central and really enduring controversy. It keeps coming up. As we discussed, that mandatory initiation ceremony, the puja, it is undeniably a Hindu ritual. It's performed in Sanskrit, involves offerings, veneration of a guru lineage. Critics also contend that these supposedly meaningless mantras given to practitioners are, in fact, often traditional Sanskrit names of Hindu deities, used for their vibrational quality in that tradition.
So the mantras might not be meaningless after all.
That's the contention of critics, yes, that they have a religious significance that isn't disclosed. This whole conflict between the secular presentation and the religious underpinnings really came to a head in a major U.S. federal court case back in 1977. It was called Molnock v. Yogi. The court ruled that teaching TM and its underlying philosophy, the science of creative intelligence, in public schools in New Jersey constituted an establishment of religion, and therefore it violated the First Amendment of the U.S. Constitution, the separation of church and state.
So the court legally defined it as religious in that context.
In the context of being taught in public schools with public funding, yes. The court legally affirmed the religious nature of the program as it was being presented then. That ruling effectively stopped the TM organization's plans to expand into U.S. public schools using government money. It was a major setback for them in that arena.
Okay, one last area of controversy.
Yeah.
Potential downsides or adverse effects. The TM organization has historically claimed there are none, but what does independent research actually show? Is it always safe?
Right. The organization has historically made very strong claims about safety, essentially saying there are no negative side effects. One prominent teacher was quoted saying something like, "There has never been any study published in a peer-reviewed journal that has shown any negative impact, only positive."
Never. That sounds unlikely for any intervention.
It does sound unlikely, and that claim is actually directly contradicted by a growing body of literature on meditation-related difficulties in general, as well as numerous anecdotal reports and published case studies, some involving TM specifically. Independent research looking across different meditation types has identified a range of potential unwanted effects. A survey from 2017, for instance, found that over 25%, a quarter of regular meditators reported experiencing at least one unpleasant effect at some point. Things like increased anxiety, panic attacks, physical pain during or after meditation, dizziness, feelings of depersonalization like you're disconnected from yourself, or derealization, feeling like your surroundings aren't real.
Wow, okay. So meditation isn't always bliss.
Not always, no. Case studies and reviews have linked various meditation practices, and that includes TM, to these kinds of symptoms. In rare cases, meditation has even been linked to the precipitation or worsening of psychosis or other serious psychiatric conditions. Because of this, it's generally advised that individuals with a history of severe mental illness, like schizophrenia or bipolar disorder with psychotic features, should definitely discuss TM with their psychiatrist before starting the practice. Caution is warranted.
So how does the TM organization explain these experiences if people report them?
This is where it gets particularly intriguing and potentially problematic from a critical perspective. The TM organization often frames these negative or difficult experiences not as adverse effects, but actually as a positive sign. They call it unstressing. The idea is that the deep rest from TM is allowing deep-seated physical and mental stresses, maybe even old traumas, to be released from the nervous system. And this release process can sometimes be uncomfortable.
So anxiety or panic could be seen as progress.
Potentially, yes. A teacher might tell a student experiencing anxiety or physical discomfort or strange sensations during meditation that this is actually proof the technique is working really effectively. It's purifying the system. Now, for some people, this might accurately describe a transient process of adjustment or release. But critics argue this unstressing framework can also serve to dismiss legitimate adverse reactions. It might prevent individuals from recognizing that the practice isn't suitable for them, or from seeking appropriate medical or psychological care when meditation might actually be contraindicated. It's a delicate line. VTM in context. Comparisons to other meditation techniques.
Okay, so to really understand TM's place, we probably need to compare it to other major meditation types that many of our listeners might be more familiar with. How does TM stack up against popular practices like, say, mindfulness-based stress reduction, MBSR, or maybe Vipassana meditation?
Absolutely. That comparison really highlights the fundamental differences in approach and philosophy. It's key to understanding what makes TM unique, both in its technique and its context.
Great. Let's start with TM versus mindfulness-based interventions, like MBSR, which is pretty well known. What's the core technical difference in how you actually do the practice?
Okay, the central distinction really lies in how they handle mental activity, thoughts, feelings, sensations. TM is categorized as an automatic self-transcending technique. It uses that mantra as a kind of vehicle, allowing the mind to settle inward effortlessly, moving beyond the thinking process towards that state of quiet awareness. Thoughts aren't the focus in TM. They're expected to come and go. You just gently, easily return to the mantra whenever you notice you've drifted off. No effort, no judgment. Mindfulness, on the other hand, especially in the MBSR format, is more of an open monitoring technique. It involves actively and non-judgmentally paying attention to whatever's arising in your consciousness in the present moment. Thoughts, feelings, bodily sensations, the breath. The work in mindfulness is cultivating this state of present moment awareness. Repeatedly, gently guiding your attention back whenever it wanders, observing whatever is there without getting caught up in it.
So TM is about transcending thought. Mindfulness is about observing thought.
That's a good way to put it, generally speaking. TM aims to effortlessly go beyond the active thinking mind. Mindfulness aims to develop a different relationship with the thinking mind and all experiences by observing them clearly and non-judgmentally. And their origins and goals differ too. TM comes from that Hindu Vedic tradition, aiming ultimately for transcendental consciousness. MBSR was developed by John Kabat-Zinn as a secular application of principles from the Buddhist tradition. Its primary goal is practical, cultivating mindful awareness and equanimity to better manage stress, chronic pain, and illness in daily life.
Okay, that distinction is clear. Now, what about their comparative efficacy? We touched on this with the PTSD meta-analysis, but overall, do the studies agree on which one is better, if that's even the right way to ask it?
That is the right way to ask if it's the right question, because the scientific evidence comparing them is complex, it's often contested, and it really reflects those methodological debates we discussed earlier, especially around the TM research. So proponents of TM will definitely point to meta-analyses, like the ones on trait anxiety or the big 2024 PTSD one, which found TM had a significantly larger effect size than MBSR in that specific context. They see that as evidence of superiority for certain outcomes. Conversely, many independent reviewers, looking at the broader literature, might conclude that MBSR actually has a stronger, maybe more methodologically sound, body of evidence overall, especially for general stress, anxiety, and depression. Partly because MBSR research is more often conducted by investigators without a direct allegiance to one specific branded program. It's a more open field of research. And remember that big 2014 JAMA internal medicine meta-analysis. It found moderate evidence for mindfulness programs improving anxiety and depression, but concluded there was basically no evidence that any meditation program, including TM or mindfulness, was significantly more effective than other active treatments, like exercise or standard behavioral therapies.
So it really depends on the studies you look at and how you interpret them.
Exactly. The picture is quite mixed. It probably depends on the specific outcome you're measuring, the population being studied, and maybe even the quality of the individual studies being included in the analyses.
Okay, let's shift gears then. How does TM compare to Vipassana? They both have ancient roots in India, but they seem quite different in practice.
That's a great comparison, too. Yes, both TM and Vipassana originate from the Indian subcontinent, but they represent really distinct streams of meditative practice. One is rooted in Vedic philosophy, the other fundamentally in Buddhist teachings. So TM, as we've said, is mantra-based. It's essentially a form of concentration meditation, using the mantra to quiet and ultimately transcend the act of thinking mind. Vipassana, on the other hand, literally translates to insight. It's fundamentally an observation-based practice. The core technique usually involves focusing initially on the natural breath, just observing it to stabilize and concentrate the mind. Then it progresses to a systematic, sweeping observation of bodily sensations throughout the entire body, noticing them arise and pass away without reacting to them, whether pleasant or unpleasant.
So not focusing on a mantra, but on breath and body sensations.
Precisely. The goal in Vipassana isn't really to transcend thought or achieve a specific state of quietness, although calmness develops. The primary goal is to develop insight, direct, experiential understanding of the nature of reality as Buddhism defines it. Specifically, insight into impermanence, everything changes, suffering or unsatisfactoriness, dukkha, and non-self, a nod to the idea there's no permanent, unchanging self. The aim is to purify the mind of deep-seated conditioning and attachments through this direct seeing.
And their origins and goals reflect this difference, too.
Absolutely. TM is a modern systematization of a practice from the Hindu Vedic lineage aimed at achieving that state of restful alertness or transcendental consciousness. Vipassana is considered one of the oldest meditation techniques within Buddhism, said to have been rediscovered and taught by the Buddha himself. Its ultimate goal is liberation, enlightenment, through the purification of the mind via insight.
Okay. And how do their learning and practice models differ? They both seem to have quite specific structures, but different ones.
Yes, their delivery models are starkly different, which has big practical implications. TM, as we discussed, is taught through a relatively brief, highly structured, and quite costly course. It's designed to be easily integrated into a regular householder's life with that standard twice-daily 20-minute practice. Vipassana, particularly in the very popular tradition of Goenka, which many people encounter, is traditionally taught in intensive, silent 10-day residential retreats.
10 days of silence. Wow.
10 days of silence, meditating for many hours each day following a very strict code of conduct. It's immersive. But here's a key difference. These Goenka Vipassana courses are offered completely free of charge. The accommodation, food, teaching, everything is covered by donations from past students who want to give others the chance to benefit.
Free versus potentially thousands of dollars. That's a huge difference in accessibility.
A massive difference financially. So Vipassana becomes highly accessible in terms of cost, but it requires a much larger upfront commitment of time, 10 days off work or away from family, and a willingness to engage in a much more rigorous, demanding practice schedule during the retreat. Anecdotally, you often hear people describe the Vipassana retreats as incredibly challenging, even exhausting, physically and mentally. While TM is often perceived as more therapeutic, easier, more relaxing, especially in the initial stages, they offer very different experiences. 6. Synthesize perspective and recommendations for you.
Okay, we've covered a lot of ground, the practice, the science, the controversies, the comparisons. So what does this all mean for you, our listener? If you're sitting there considering transcendental meditation, how do we synthesize all this information into a practical understanding?
All right, let's try to bring it all together if we connect this to the bigger picture. Transcendental meditation presents itself as a simple, highly standardized technique. It's generally easy to learn, doesn't require complex postures or philosophies up front, and it's designed to be integrated pretty easily into a daily routine. There's a vast body of research, which is heavily promoted by its parent organization, supporting its efficacy for producing a unique state of deep physiological rest. And this state seems to translate into significant measurable benefits for things like stress reduction, cardiovascular health, especially blood pressure, and certain psychological conditions like anxiety and notably PTSD. The evidence in those specific areas, particularly the findings on blood pressure endorsed cautiously by the AHA and the strong meta-analytic data for PTSD, that evidence is compelling enough that TM is positioned as a credible complementary therapy in some clinical settings.
Okay, so the benefits side seems strong in specific areas.
It does. However, this positive profile absolutely has to be weighed against those substantial and persistent controversies we discussed. The scientific evidence, while there's a lot of it, remains shadowed by those valid concerns about researcher allegiance bias and methodological rigor in some studies. Independent analyses often yield more modest or sometimes conflicting results compared to the TM-affiliated research. And there's the TM organization itself. Its commercial structure, the high costs, the somewhat secretive nature, these have led to decades of criticism and those accusations of it being a cult-like enterprise. That's a factor potential users need to consider. The fundamental disconnect between its public image as a secular scientific technique and its private, mandatory religious rituals like the puja remains a significant point of contention. It raises questions about transparency for people signing up. And finally, the risk of adverse psychological effects. While often reframed by the organization as unstressing, it's a real consideration documented in the broader meditation literature. It warrants caution, especially for individuals with a pre-existing history of significant mental illness.
So given this really nuanced view, strong benefits in some areas, but real concerns and controversies too, what would our recommendations be? Who is TM actually for, and who should perhaps be more cautious or look elsewhere?
Okay, let's break it down for different types of potential practitioners. First, for the general public just seeking stress reduction and overall well-being. If you have the financial means, that's a big if, and you're looking for a very simple, structured, easy-to-learn method for managing stress, TM does appear to be an effective option based on much of the research. That twice-daily routine can provide a really consistent anchor for well-being in a busy life. However, you should go into it fully aware of the significant financial commitment involved, aware of the proprietary nature you can only learn it this way, and aware of those quasi-religious elements in the initiation ceremony so you can decide if that aligns with what you're looking for.
Okay, what about people with specific clinical conditions like high blood pressure or PTSD, where the evidence seemed particularly strong?
Right. For patients with diagnosed conditions like hypertension or PTSD, the evidence suggests TM could be considered as a promising adjunctive therapy. Adjunctive is the key word here, meaning it should be used in conjunction with, not as a replacement for, standard medical and psychological care provided by healthcare professionals.
So not instead of medication or therapy.
Definitely not instead of. But the American Heart Association's cautious endorsement for blood pressure and that strong meta-analytic data for PTSD suggests TM can be a powerful additional tool for some patients. If you fall into this category, the best approach would be to discuss incorporating TM into your overall treatment plan with your doctor or your therapist. View it as a significant lifestyle intervention, maybe akin to adopting a healthy diet or regular exercise program as part of your care.
That makes sense. Now, what about the group you mentioned needing caution individuals with a history of psychosis or severe mental illness?
Yes, for this group, extreme caution is definitely advised. The potential for any intensive meditation practice, including TM, to sometimes induce or exacerbate symptoms like depersonalization, derealization, or even psychosis is a documented risk, though likely rare. So for this population, TM should really only be considered, if at all, under the close supervision of their treating psychiatrist. It would require full disclosure of your mental health history to both your doctor and your certified TM teacher before starting, and careful monitoring. It's not something to undertake lightly in this situation.
Understood. And finally, what about people who are maybe skeptical of the organization or just can't afford the high costs? The financially constrained inquirer, perhaps?
Right. For the skeptical inquirer, or someone for whom the cost is prohibitive, given the high fees and the controversies surrounding the TM organization's structure and claims, you might find other meditation practices more suitable or accessible. Techniques like mindfulness meditation or vipassana are widely available now. You can learn them through books, reputable apps, community centers, often for very low cost or even entirely free, like the vipassana retreats. And it's worth remembering that, quote, attributed to Maharishi himself, that he once stated, essentially, that any sound could potentially serve as a mantra. So if you're specifically interested in mantra meditation, but wary of the TM organization's proprietary system and cost, you can explore other, less commercialized forms of mantra practice that exist within various traditions.
Right. So ultimately, it sounds like the decision to practice transcendental meditation is a really personal one. It required carefully weighing those potential and possibly significant benefits against the associated costs, the organizational controversies, and the potential risks involved for you as an individual. Outro. Well, that was a truly deep dive, wasn't it? Into a practice that, on the surface seems so straightforward, sit quietly, repeat a mantra, yet it holds so many layers of complexity. Science, spirituality, business, controversy. It's all in there. Hopefully this deep dive has offered you, our listener, a much more informed, maybe a fresh perspective on TM.
Indeed. We've explored its potentially profound effects on the body and mind, looked at the research supporting that. But we've also tried to candidly address those methodological debates around the science and the significant concerns about its organizational practices, its cost, and those religious undertones that aren't always up front.
So what does this all mean for you? Here's maybe a final provocative thought to leave you with. If, as Maharishi Mahesh Yogi himself apparently once said, any sound could serve as a mantra, what does that really imply? What does it suggest about the inherent power of the meditative technique itself versus the specific structure, the cost, the ceremony, and the claims made by any one proprietary system selling that technique? Something to think about, isn't it? Food for thought. We hope this deep dive helps you navigate the vast world of well-being practices with a little more clarity.